This video will discuss thyroid binding proteins and their disorders. Both T3 and T4 are bound to proteins. What percentage of T4 and T3 are bound to the proteins? More than 99.7% of T4 and T3 are protein bound, but T3 is bound less tightly, so T3 is more unbound than T4. The unbound hormone is biologically active and available to tissue, and that's T3. Free hormone are physically active, and this inhibits the TSH. Free thyroid hormone in the plasma are in equilibrium with protein-bound thyroid hormone in the tissue. So what are the proteins to them thyroid hormone bind? The three proteins to which thyroid hormone bind are albumin, prealbumin, and globulin. Maximum amount of thyroxine binds to thyroid binding globulin, which is about 1 to 2 mg per 100 ml, and more than 80% of the hormone binds to thyroid binding globulin, whereas albumin, which is the largest and maximum in quantity 3.5 gram per 100 ml, binds to 30% of T3 and 10% of T4, whereas prealbumin it binds to very little T3 and 10% of T4. So what are the effects of protein binding or benefits of protein binding of thyroxine hormone? It increases the pool of circulating hormone, it delays the hormone clearance, it controls the hormone action, and may modulate hormone delivery to the selective tissue. Its sudden rise in binding proteins temporarily decrease free thyroxine, which stimulates TSH secretion. So what are the conditions when thyroid binding globulins are increased? They increase in pregnancy and women taking estrogen, and they are decreased in with anti-estrogens and androgens, and also with glucocorticoids and L-asparginase. So what are the drugs which inhibit binding of T4 and T3 to thyroid binding globulins? They are salicylates, phenytoin, mitotin, op-DDD, and 5-fluorouracil. The abnormalities of thyroid binding protein. Number 1. X-linked deficiency of thyroid binding globulin. In this condition, there is low T4 and T3 and normal unbound hormone, and patient is usually euthyroid and TSH is normal. Efforts to normalize T4 leads to thyrotoxicosis. Number 2. Mutation in thyroid binding globulin, thyroid binding prealbumin, and thyroid binding albumin leads to increased binding affinity of T4 and T3. So there is increase in total T4 and T3, but normal unbound hormone levels and normal TSH also. Number 3. Euthyroid hyperthyroxanemia. Pregnancy and those taking estrogen. In these conditions, there is high thyroid binding globulins, high T4 and T3 levels, and normal unbound T3 and T4. Drugs that displace thyroxine from protein bindings are salicylates and salicylates.